So, okay, Tanya. So, as a finance coordinator for MSF, how do affordability issues and the fact that the majority of drug development is done by for-profit companies, how does this affect the ability to provide required health care to those in need?
Okay, thanks, Rebecca. So the shortest answer to that question is that we can't. MSF can't provide comprehensive health care on the same level that we have here in the West until two main issues are solved for. And those are, the two issues are availability and cost. So in the current R&D system, as Rebecca indicated during the question, in the current R&D system, the majority of research for new drugs is done by for-profit pharmaceutical firms. And obviously, for-profit pharmaceutical firms have an obligation to their shareholders. So when you are Pfizer, GlaxoSmithKline, Merck, one of the big pharmaceutical companies, and you're deciding where to put your R&D dollars, you're going to put it towards things that have a return on investment, things that have an ROI. So things like back pain, hair loss, skin conditions, things that are very common to us here in the West, these garner a lot of R&D attention, a lot of R&D money. But diseases that affect the poorest people on the planet, who have diseases that we haven't even heard of here in the West, like Ascariasis, onchocerciasis, dracunculiasis, these unpronounceable things that we haven't even heard of in the West, big pharma, the pharmaceutical firms, don't put R&D into this because there is no return on investment. The academic euphemism is there's no viable market, there's no viable commercial market. And it just simply means that they don't have money. These patients don't have money to pay for the drugs that cost a heck of a lot of money to develop. So the current global system, in terms of availability of drugs, the current global system has this massive disconnect where research and R&D dollars are put into diseases that affect people who live in rich countries, and we have this neglected population of about 1 billion people where R&D dollars don't flow because there isn't a market that can afford to pay for the medicines. So what that means for MSF staff, for MSF doctors in the field, it means that we don't have drugs to treat certain illnesses, or we're using bad drugs. We're using drugs that have horrible side effects that are very complicated to administer. And obviously that's a huge problem for our staff and for our patients. And there's an interesting statistic that I'll share with you that shows the scope of this issue. And it's a statistic from DNDI, which stands for the Neglected Diseases Initiative, which is a non-profit research drug research company that MSF, a drug research organization that MSF is part of. Okay, so according to DNDI, 850 new drugs were released for public use between 2000 and 2011. And somebody from the audience, take a guess. What percentage of 850 drugs do you think were for neglected diseases?
1.
0.2. 0.2, someone said.
I heard a 1. Okay, you guys are actually even more pessimistic. It's actually 4. So that's about 30 drugs out of 850. Right? So that gives you an idea of how little attention these diseases are getting, hence the term neglected diseases, right? They are not focused on by for-profit pharmaceuticals. And so that's why things like DNDI and the BSC initiative that we're meeting with tonight are so important. So those are some comments on the availability side, but I said there are 2 issues. Second issue is cost. The cost of drugs is a very, very, very complicated topic, and lots of academics and researchers put use up a lot of paper trying to figure out, trying to do analysis on the cost. But I can, for the purposes of tonight's presentation, I can boil it down to one word, and that's patents. When a pharmaceutical company invents a new drug, creates a new drug, they patent it. Of course, because when you patent it, it means nobody else can produce it. So you're the sole producer for 10, 20, 30 years, whatever the life of your patent is. And that means you can charge whatever price you need or whatever price you want in order to recoup the R&D costs and to make a profit. The problem is, of course, that the course, 1 million who live off $2 a day can't afford to pay patented prices. An example is the patented price for the drug here in the West for the drugs that treat hepatitis C. There's 2 pills, and the total cost is $1,750 for the 2 pills. That's just one course. So of course, if you live off $2 a day in South Sudan, there's no way. Another example that MSF is very vocal about is pneumonia. Childhood pneumonia kills 1 million kids a year. So MSF is something that MSF doctors see on a regular basis. So it's something that the group is very vocal about. And so MSF petitioned the company that owns the patent on the pneumonia vaccine, Pfizer. MSF launched a very vocal campaign in 2016 and actually succeeded in getting Pfizer to reduce the cost for the vaccine just for MSF and organizations like MSF. So the vaccine is called Prevnar 13. If you buy it here in Canada, according to the Travel Medical Clinic, it's about $125. MSF was able to negotiate it down with Pfizer through public pressure that we can buy it for $9, approximately $9 for the course of 3. MSF wants it even lower. MSF wants it as low as 5 because obviously the lower it is, the more we can buy, the more children we can vaccinate, and the more we can do for our beneficiaries. So that's a summary of the 2 problems in the current global situation. Lack of availability of effective drugs and too high a cost due to patents. I think I will end on a slightly optimistic note because I think the fact that we're here tonight, it means that the landscape's changing. It means that other actors, universities, nonprofits, are starting to enter into this arena, and they're increasing awareness of the fact that there is a problem here. So hopefully we are starting to see the landscape change where this disconnect is going to be minimized.